You don't need a report to know that healthcare pressure is rising. Workers feel it every time they check a chart or staffing schedule. And each time, they realize they are stuck focusing on paperwork instead of their patients. These challenges are systemic and heavy. We are facing a global shortage of healthcare providers. WHO estimates a projected shortfall of 11 million health workers by 2030, mostly in low and lower middle-income countries. Crucially, the Philips Future Health Index 2026 report highlights that healthcare systems are tackling patient backlogs by aggressively integrating AI. By automating routine workflows, AI saves clinicians an average of 132 hours annually, allowing them to see about 8 additional patients per week and directly address long wait times. But for many clinicians, the most frustrating part isn't the volume of patients. It's the administrative burden. Documentation, billing, and data entry have become labor-intensive tasks that pull focus away from what you actually trained to do, which is care for human beings. This is exactly why artificial intelligence is no longer a futuristic concept. It is a measurable intervention. AI offers powerful tools to solve these exact problems. By automating medical coding, streamlining billing, and handling routine note-taking, AI frees up healthcare providers to focus on the work they love. But as we integrate these tools, we have to be clear. The goal isn't to hand the keys over to the machine. The goal is to build a partnership. As an overwhelming majority of healthcare leaders and clinicians move to adopt generative AI at scale, we must ensure this transition is handled with transparency, security, and a relentless focus on ethics. AI is not just theoretical anymore. It is currently being deployed across the spectrum of medicine to improve outcomes. Take medical imaging and diagnostics. AI in radiology is acting as a second set of eyes for radiologists. By flagging early signs of lung cancer, breast tumors, or strokes, these tools allow doctors to prioritize the most urgent cases with unprecedented speed. In areas like diabetic retinopathy, AI is now screening retinal images with high accuracy, helping clinicians catch conditions before they progress. Then there is healthcare predictive analytics. In the high-stakes environment of an ICU or emergency department, time is the most valuable resource. Predictive models can now analyze vast datasets to identify a patient's risk of developing sepsis hours before symptoms become visible. This allows for earlier intervention, saving lives that might otherwise be lost. For chronic care, these tools help identify high-risk patients who are likely to be readmitted, allowing care teams to be proactive rather than reactive. In the lab, the role of AI in drug discovery and development is being revolutionized. Modeling complex biological systems used to take years. AI can now simulate drug interactions and identify promising candidates in a fraction of that time. This capability was a lifeline during the COVID-19 pandemic, and it is now accelerating breakthroughs in oncology and infectious disease. Furthermore, the use of AI in personalized medicine is moving from a buzzword to a standard of care. By combining genomics, electronic health records, and data from wearable devices, AI helps clinicians predict how a specific patient will respond to a particular treatment. This reduces the trial and error approach to prescribing medicine and significantly lowers the risk of adverse drug reactions. Finally, virtual health assistants and operational optimization are helping hospitals run smoothly. AI-powered chatbots handle routine triage and post-surgical follow-ups, which lowers the administrative burden. Behind the scenes, AI manages bed capacity, supply chains, and staffing. When the hospital runs efficiently, the patient receives better care. While diagnostic and administrative tools are leading the way, AI's impact is rippling into every corner of clinical practice. In orthopedics, we are seeing a move toward precision reconstruction. AI now assists in complex preoperative planning and even integrates with smart implants that track a patient's recovery in real time, sending data directly to the surgeon to catch complications early. In psychiatry, the focus is on early intervention. AI models analyze wearable data, like sleep cycles and activity levels, to detect subtle fluctuations in mood, helping clinicians catch the early warning signs of a mental health crisis. Dermatology is perhaps the most visual success story. AI algorithms are now achieving diagnostic accuracy rates that often rival specialists when classifying skin lesions, effectively acting as an expert filter that helps dermatologists prioritize high-risk patients. Meanwhile, in pharmacy, AI is functioning as the ultimate safety net. By continuously scanning patient records, these systems identify potential drug-to-drug interactions that might be missed in the complexity of a long-term medication list, helping pharmacists identify potentially dangerous drug interactions before prescriptions are finalized. Finally, at the public health level, AI is acting as a global early warning system. By analyzing patterns in search trends and travel data, epidemiologists can now track the trajectory of infectious diseases in real time, allowing for a faster, more targeted public health response. It is important to address the misconception that AI is here to replace clinicians. The reality is that AI is augmenting their roles. By taking the heavy lifting of data analysis and routine administration off their plates, AI allows nurses, doctors, and care coordinators to focus on clinical decision-making. The economic argument is just as compelling as the clinical one. A McKinsey analysis estimates that generative AI could create between $60 billion and $110 billion in annual value for the American healthcare industry. This value comes from increased efficiency, reduced diagnostic errors, and better resource allocation. These savings allow facilities to invest back into their teams and patient services. Investment is pouring in from both the public and private sectors. Regulatory bodies like the FDA are building new frameworks to approve machine learning tools, creating a clearer path for innovation. Hospitals and startups are hiring teams to integrate these platforms, signaling a long-term shift in how we envision the future of medicine. Despite the potential, we must move forward with caution. AI comes with an enormous responsibility. The first hurdle is data privacy. AI systems require massive amounts of data to learn, from our most private medical histories to real-time data from our wearables. Without rigorous cybersecurity and ironclad privacy protections, we risk eroding the trust that is foundational to the patient-provider relationship. The second hurdle is algorithmic bias. If an AI is trained on incomplete or biased data, it will produce biased results. If we don't ensure that the data represents diverse populations, we risk widening existing healthcare disparities. This is why explainability is so important. Clinicians need to understand why an AI made a recommendation so they can verify it. Finally, there is the challenge of human oversight. In high-stakes scenarios, like end-of-life decisions, the final call must always be made by a human. AI is a tool, not a moral agent. We need robust accountability frameworks to ensure that as these systems evolve, they remain safe, transparent, and fair. But there's another reason caution matters. AI doesn't always get medicine right. Researchers at the University of Oxford found that popular AI chatbots could provide inaccurate or inconsistent medical advice, sometimes giving different recommendations to the same question, or leaving out critical clinical details. That's a reminder of what today's AI really is. It's exceptionally good at recognizing patterns in information, but it doesn't understand illness the way a trained physician does. It doesn't examine a patient, weigh subtle clinical signs, or take legal responsibility for the outcome. Used responsibly, AI can become an incredibly powerful clinical assistant. Used without verification, it can introduce risks that no healthcare system can afford. The human role is more important than ever with AI. The future of medicine isn't human versus machine. It's clinicians and intelligent tools working together. At the end of the day, the goal of integrating AI into healthcare is simple: to make the system work for people again. By adopting AI ethically and transparently, we have the opportunity to reverse negative trends. We can reclaim time for doctors and nurses, improve the accuracy of our diagnostics, and provide care that is truly tailored to the individual. Artificial intelligence won't solve every problem facing healthcare. It won't eliminate staff shortages. It won't replace experience. It won't remove the need for compassion. But if it's designed carefully, tested rigorously, and used responsibly, it can help remove some of the administrative and analytical work that has slowly pulled clinicians away from patients. That's why many experts don't see AI as the future doctor. They see it as the future clinical partner. The real success of AI in healthcare won't be measured by how intelligent the technology becomes. It will be measured by something much simpler: whether doctors spend more time treating people and less time treating paperwork.